It is the popular saying that a healthy society is a wealthy one. On the Great Mind program, medical experts are available to provide solutions to various health challenges. You desire greatness in life. Successful men and women in the society are available on the Great Mind program to reveal to you the secrets to their greatness. The Great Mind of Nentiu Shugbo is a watch for all. Meet me on the program every Sunday between 3:30 and 4 p.m. Happy Sunday to you all. It is the day that the Lord has made. I will rejoice and be glad in it. It is another wonderful moment with me, Bola Olayemi, on the program, The Great Mind. The personality we are celebrating on the program this week is Pastor Moses Olayemi, popularly known as Mosodun. Meanwhile, on the S segment, our gist centers on the activities of Osun Health Insurance Agency concerning the capitation for the free medical care. It is to be recalled that Osun Health Insurance Agency in the year 2018, through an enactment with the sole aim of providing qualitative healthcare services free from financial hardship for the residents in Osun State, the support given by Governor Adegbeyinka to Osun Health Insurance Agency is unsurpassed, as the well-being of the people of the state is paramount to its administration, because health remains the bedrock of development of any society. Osun Health Insurance Agency is committed to the realization of its aim of making every resident in the state to have access to qualitative health care without tears. In the year 2020 alone, Osun Health Insurance Agency recorded 117 successful surgical operations. Among the beneficiaries is Ms. Ramata Adetunji, a fire incident victim who is a constituent of the chairman governing board of Osun Health Insurance Agency, Honorable Adeoye Adelakun. Few weeks ago, Osun Health Insurance Agency embarked on the enrollment of the vulnerable people across the local government areas in the state to benefit from the free health care services of Osun Health Insurance Agency, since many people cannot afford huge medical bill being required to take care of their health. During the enrollment of the vulnerable at the public health centers across the local government areas of the state, people trooped out en masse to benefit from the free health care of Osun Health Insurance Agency.
We really appreciate what they have done. This week we appreciate, everybody appreciates the effort for this program. We appreciate them, we thank them for the program.
Thank you for introducing this type of program. We really appreciate it. We've done for everybody. I wish you the best of it. We wish the government the best of it. We have tried for the program. And we are enjoying it very well, and our people are so happy, because I can say this is the first time for this type of program we are doing.
I only thank for God for this program, and God will help them in all everything they do. I'm very happy.
The government
have to appreciate the NHIS, then I have to appreciate the Health Insurance Scheme, then the state government of Osun State. They are all appreciated for this kind of program. They want people in the rural area, in their villages, to have benefit from the health, and God Almighty will be with them.
It's a good thing, not only for the civil servants, but everybody to enjoy. You know, it's only the civil servants that are doing the ones. But now everybody, all men, women, young, old, will now be benefiting from these ways. So it's a good thing. They are trying. I really commend them.
We thank Dr. Oyesola, and we pray that God will give the opportunity to continue the program.
We thank our amiable governor for giving us this opportunity. So thank them so much.
It's very nice, it's very good, because there are many people in the community. They can't afford to pay your hospital bill. there are some disabled, there are some poor of the poorest. For this program, they'll be able to access the eggs freely, without pay anything. So if there are any people who are coming for this program, I pray that we Almighty Allah continue to help him progressing to lift your systems to the higher level. He's trying.
Adúgbòlọ́wọ́ gómìnà ìpínlẹ̀ Ọ̀ṣun fún àti àwọn ìgbìmọ̀ tí wọ́n jùlọ tó ṣe pa ètò yìí fún àǹfààní tí wọ́n fún àwọn ènìyàn láti kà wọ́n yẹ kí wọ́n rántí wọn láti ṣe ètò ìlera fún wọn. Torí ọ̀pọ̀lọpọ̀ ni àìsàn ṣe tí ẹbí kò sì sí owó lọ́wọ́ wọn láti lè tọ́jú ara wọn. Èyí sì jẹ́ àǹfààní fún wọn lọ́pọ̀lọpọ̀ láti lè gba ìlera ọ̀fẹ́ tó péye.
Ìjọba àpapọ̀ ìjọba ìpínlẹ̀ Ọ̀ṣun pẹ̀lú àwọn àjọ àgbáyé tí wọ́n gbé ìlera alábọ́dé tó gbé kalẹ̀ bákan náà ni pé wọ́n gbé ètò ìlera fún àwọn tí ò rọ́wọ́ bọ̀rí àdúgbò lọ́wọ́ ọlọ́ba fún àwọn náà lọ́wọ́ fún àwọn àwọn èèyàn jáde gan torí pé lákòókò tá a bá sọ pé ajé àǹfààní ìjọba ò ní wá máa kó fún wa nílé tí ìjọba ní í ṣe náà fún wa náà ni pé bóun ni ó ṣe mójútó ìlera wa bóòlù láti lórí omi tó mọ́ gara bóòlù láti rí mu bóòlù láti lọ́nà ọ̀nà tó yọ̀ bóòlù láti rìnrìn ṣùgbọ́n tàbá ìjọba wa mọ̀ fún wa fún wa ní kò lè kárí tó kárí náà ni ìwòsàn ọ̀fẹ́ tíjọba fẹ́ ṣe ìlú ilé tí ń ṣe a sì dúpẹ́ fọlọ́n pé àwọn èèyàn jáde gan púpọ̀ ojúlé sójú náà ni àwọn èèyàn ti jáde wá fún ètò yìí fọlọ́n bá kún ìjọba ní ọwọ́.
A dúpẹ́ lọ́wọ́ Ọlọ́run fún gbogbo ìgbésẹ̀ tí àwọn gọ́ọ̀mẹ̀ntì gbé nìsín kọ́gbọ́n tí ò lọ́wọ́ wọn rí tó wà lẹ́gbẹ̀ẹ́ tó pé káwọn fẹ́ lọ nǹkan tó wá sí bíbà wọn á gbogbo ọ̀fẹ́ àwọn aláwọ̀ boyún wọn rí ìwòsàn ọ̀fẹ́ gbà wọn gbogbo tó péye àwọn àgbàlagbà bí àwọn tó rí àwọn handicap tó yẹ pé kò sí ò lè rí agbára láti ṣiṣẹ́ bọ̀ tó bá wá sí hospital mídàkó tó wà gómìnà ti pèsè ògùn pẹ̀lú àwọn supporters tó ń kún wọn lẹ́gbẹ̀ẹ́ wọn rí ògùn gbà déédéé ìwẹ̀ sì lọ nílò ètò ìwẹ̀ sì lọ dáadáa àdúpẹ́ lọ́wọ́.
The turnout is really encouraging, I must say. Initially in the morning, because many people have been here in the morning. Though so far so good. We have almost about 220 names here, but though we're expecting about 500 on this our center. We're expecting about 500, but we see instead maybe by the end of the day we'll meet that target because many people are still also coming. Seriously, we really appreciate this program from the government, honestly. Even most of our members of the community are really pleased because we all know at least this, particularly this time that at least we all know the things that we are facing. Many people are not that buoyant in terms of when it comes to handling themselves in the health issue. So when they heard this program, they were very happy. So we really want to appreciate the governor, most especially for giving this opportunity to the community. Really appreciate it, and we say thank you very much.
So they will give us time, and that time will be used for the span. So any hospital that you have the opportunity to go, if you are sick, you don't have to pay them, you don't have to pay anything. You just give them the card and they treat you. You have to pay free treatment, free health care.
We appreciate the work of our governor, Governor Adegoye for the work done on the Osun State Health Insurance Scheme for the people in the Osun State. The program is very good and very interesting, even for the less privileged in the Osun State. So there are some diseases covered for this OAs. It helps most of the people, pregnant women, children under 5, all the people, all the citizens in Osun. Today is the day selected for the PAC and all focal facility in Osun State for capturing of the people in the community.
And this program is being organized for the vulnerable people. And these people on ground that are enrolled, they are vulnerable people. And through this program, all of them will be benefited. So it's a good program. And if anybody needs health care service, it's a free of charge without paying CC. So it's a good program that's organized by the government. Appreciating Osun State Governor Alhaji Gboyega Oyetola, who organized this program for the common people. And I'm appreciating Osun Health Insurance team because majority of our people, I mean the common people, they are unable to avoid the healthcare service being rendering to them before. But with this program organized by Osun State government and the Osun Health Insurance scheme, people will be able to participate and come into the primary health care to have their own health services and need to benefit under this program. So we appreciate them for organizing this program. They really try for the common people.
We really appreciate it because this program is just introduced by this government for the development of the people. So the community appreciates the program. You see that people come from everywhere to register for this program. So we appreciate him very much.
Ètò yìí dáa gan nítorí pé ẹlòmíì gan kò lálàáfíà bẹ́ẹ̀ kò lówó láti mú lọ sí hospital láti lọ kọ̀pẹ́ nígbà tí ò ságbára ṣùgbọ́n lóde tán gbé kalẹ̀ yìí ó fún àǹfààní anybody láti wá sọ ètò ìlera tó ń ṣe lágọ̀ọ́ ara fún wọn láti lè fún wọn ní oògùn ọ̀fẹ́ kí ìwòsàn yẹn fi lè dé àlàáfíà fi lè dé ilé ayé wọn so a gbàdúrà fún ìjọba Oyètọ́lá àwọn àmọ̀tẹ̀wọ̀n síwájú àwọn oríṣi ilé iṣẹ́ wọn ò ní jóná gbogbo àwọn tó ṣàgbátẹrù rẹ̀ ọlọ́ọ̀bá wa gbé wọn dájú bí wọ́n ṣe wà lọ.
lọ́lọ́ọ̀dì ọba dáa fún wa kò fẹ́ ká sọ̀rọ̀ náà ni ọlọ́ọ̀sì ní bí àṣàìsàn ìrànlọ́wọ́ náà kò jù bá náà fáwọn àmẹ̀kànnà ọmọ bá ṣàgbéga ó ṣíjú àánú gbogbo wa kọ́mọ̀jì àṣà rẹ̀.
Government of the APC in Osun is very, very, very particular about the health of the people. And having gone through various means by which they can touch the lives of the people, particularly the poorest of the poor, that we refer to as the vulnerables. The bill was actually put in place to ensure that the health of the people is taken seriously.
We have been to the nooks and crannies of this state. 332 wards. We have been to each of those facilities. In fact, the exercise is running up today. We've been at it for more than 6 weeks. We have combed everywhere. The far to reach area, Sokoto, Faforiji, all places, Abagboro, Ife Central, we have been to everywhere. We have enrolled the people that are the vulnerable in those wards where they will be receiving treatment from that particular facility. Now, we saw that many people came out who are actually not vulnerable. So the people that are not vulnerable, we have told them what to do. What they need to do is pay insurance premium and they will continue to receive treatment for 1 whole year for just that paltry sum of 12,060 naira, just about 1,000 per month, and they can receive treatment from the benefit package for the whole of the year. We have explained that to them. This exercise has taken us to all of those facilities. In fact, I don't think, even if you are going to be doing electioneering campaign, I don't think any governor would have gone to all of those 332 in one round of campaign. But we have been there and we have told them what government is doing. That the government of the day, led by Mr. Adeboyega Oyetola, has shown immense goodwill to ensure that the good people of this state have good health care for them. That is what he has done by making sure that the equity fund is available in addition to the basic care provision fund, also ensuring that the 3% that government is supposed to add to the deduction from civil servants are added. He has been adding that regularly, and that has been the backbone of the success of health insurance in Osun State.
More so for the effective and excellent performance of the stakeholders in public care system in Osun State, Osun Health Insurance Agency, in the interest of the entire citizenry, embarked on organizing facility level training for the ward development chairmen and public health providers on the operation of the Health Insurance Gateway of Basic Health Care Provision Fund.
Well, we thank God, though it was rough when we started. It was very rough. It wasn't just rough, it was very rough. But how far we have gone, Thank God.
So I want you to actually take everything that is being said here very seriously, to be able to be guided properly, so that you don't run foul of whatever principles.
All the operational issues have been discussed, and now we can say that the State Primary Health Care Board and Osun Health Insurance Agency are on one page to move forward the implementation not only of Basic Health Care Provision Fund, but of health insurance, even at the primary health care level, which is the way forward to achieving universal health coverage.
To be issued cards by Governor Adegboyega Oyetola for the free health care of Osun Health Insurance Agency. They already captured vulnerable across the local government areas in Osun State to be issued cards by Governor Adegboyega Oyetola for the free health care of Osun Health Insurance Agency. As I said earlier, that the personality we are celebrating on the program this week is Pastor Moses Olayemi, popularly known as Mosodun, who, through the mercy of God, moved from grass to grace. This is the origin of Olayemi's family in that Buddhist compound on your Odotin local government, where Pastor Moses Olayemi was born 4 decades ago. A month after his birth, his father and the whole family migrated to Bankwemo, Ilioluju in Ondo State, where he started his elementary education. He attended St. Paul's Primary School, Ilioluju, between 1969 and 1974. He was introduced into farming immediately after his elementary school, as he was compelled by his father to work in the farm for 1 year before he proceeded to secondary school.
Family of Olayemi. My father's name is Nathaniel Olayemi of Agodis compound Onyo. My mother's name is Grace Niyoyeladun from Opanis compound Onyo. And I was born at Onyo. 30 days after, I was taken to Ondo State, that is Bamikemu, via Ilioluju, where I had my primary school at St. Paul's Anglican Primary School between 1969 and 1974. There and then, at that time, they said so that we'll be able to know how to spend money very well, that we should work on the farm for 1 year. So we did post-primary school NYC in my father's farm. That is between 1974 and 75. Then I moved to Shagam, to Temidiri Secondary Commercial Modern School, Shagam, for 3 years, before I moved to Road Grammar School in 1979. And I finished at Road Grammar School in 1982. I could remember June 4, that was the last day of our exam, because we used to say that whether they like it or not, I will leave Road Grammar School by June 4. Well, and as God will have it, JAMB and the WAEC, they smiled favorably towards me. And by December 14, I was already in UI studying veterinary medicine. By July 1988, I graduated.
So Moses Olayemi, how's this experience in his school days?
It's not too difficult because my father, you know, people from Onyo, they went to Ghana. And the people from Onyo, they became very literate. The people from Onyo, like for example, even as I'm talking now, if you're a doctor, if you're a professor, there is no area that you will come from, that it will be your discipline. And you'll be a one-man show in Onyo. So, you know, people of Onyo, from Onyo, they know the value of education. So, my father will take even usury, will go and borrow money and do everything to make sure that education is very, very important. It's not now that the people from our town that are knowing about education. So, not that there was money, but at least they made it a point of duty that all of us should go to school.
Pastor Moses Olayemi, who did his national youth service in Sokoto, came to Osogbo through his uncle, Mr. Raji Folonosho, to start his own business with the money he was able to save during the service year. He then rented a shop from where he did most of the consultancy services in the veterinary field. As an innovative and well-trained vet surgeon, he launched into animal feeds, production and livestock farming, from where he gained popularity.
I served in Sokoto State at Sokoto City Veterinary Clinic. After then, since my brother, Mr. Folonosho Raji, has moved to Osogbo, so I came to join him and I started my veterinary practice, which I've been doing this up to this present moment. This is the 19th year. So I started the what we call Mosodun veterinary setup. I started it from my NYC savings. And Mosodun, that is, my own name is Moses. My wife's name is Odun. So we joined the two together to make Mosodun. That is what it is till today. I've never had the opportunity of using my certificate for anything. I've never presented my certificate for anything. I've not used it to get a job or a contract or anything. In fact, there was never a time that somebody asked me, where is your certificate? I've never used it. I've never touched it for anything.
Mrs. Temilade and Mr. Raji Folorunso are the couple that accommodated Pastor Moses Olayemi for some years while he came to Osogbo to start his life.
He came to Osogbo through me. He was living with me. In fact, when he was in the university, he was living with me. He's a good boy. In fact, I can say that he's somebody that is good to emulate his character. He did very well when he was according to what he has been doing, is what is following him now. You can realize that he has achieved very well, and I pray that God will be helping him.
Very beautiful and painstaking man. He stayed with us at Ibadan during his university program, when he was undertaking his university program. And in fact, he did not behave as other brother-in-laws would behave. He's ready to serve me. If I wake up in the morning, he might have fetched a drum of water. Even the place we use for food, before getting to the kitchen, to the sink, we find it cleaned up. I wonder the type of brother-in-law he is. And that was exactly what is following him now. The dutifulness that he has, the nature of his hard work is what is following him now. And that was the major reason why he aspired high, and he will still continue to aspire high. As old as he is, he cannot see me carrying bag, even this small bag. He will take it from me. He's very respectful, very, very respectful. In fact, I don't know the adjective that I can use to qualify him.
Pastor Moses Olayemi, who is now the managing director of Mosodun Feed Me, got married in 1991 to his beautiful wife, Odola Alice.
The point is, when somebody is very, very active, like for example, I'm very restless. In fact, I used to ask people that anytime there is a public holiday, I used to ask people, how would those that are government workers, how would they feel if they will not go to a place of work for a whole day? In fact, I'm so restless. In fact, it was as a result of my restlessness that made me to meet my wife. At that time at Bamikemo, during the holidays, we go to the farm. By the time we finish the farm of my father, then we'll be looking for those that are maybe the uncle to my father will be to go and work on their own farm when we have finished our own. And our own uncle that she used to come to see at that time, any cola that they cannot harvest because of a driver hunt and all these other ants, I would just go there. It was there that she knew me.
Mrs. Odola Alice Olayemi asked this to say about her marriage to Pastor Moses Olayemi.
I met him in 1984 at Bamikemo in Leoluji area, Ondo State. And we courted for 7 years. That is between the time we met, 1984 and 1991. So we wedded in 91, and since then, by the grace of God, in fact, the first thing I want to say concerning the life of this man is that he's a godly husband by the grace of God. He fears God, he loves God, and he serves Him. And the most important area of his life concerning spiritual matter is that he loves paying of his tithes. He makes sure that he pays his tithes regularly, and even in offering to God. So he gives to God, he gives to humanity, and God has been so faithful to him. He has been blessing him tremendously. That is in the first place. Secondly, he's a man that loves his family. He's a loving man, he's a caring man. He loves the wife, he loves the children. At the same time, he used to give to the needy. In fact, he is a giver by the grace of God. And just as I said at that time, that because of this, God has been blessing him tremendously.
Pastor Moses Olayemi has contributed immensely to the growth of the economy of Osun State in different dimensions, such as the provision of employment, in which over time provided employment for more than he has his advice for all.
Decide to be responsible of all the abilities in life. The greatest is to be responsible. I used to tell people that you are not to center your life, even as a man, into pleasing your wife, because you can never do that. But you can decide to be a responsible husband, so that when the wife is looking at you, when your parents, they are looking at you, when your peers are looking at you, they will say, no matter what you will say concerning this man, he is a responsible person. And if you are responsible, there is no limit, there is no level that you cannot reach in life. So my advice for everybody is that people should be responsible. But why don't you ask? People are too irresponsible. Many men are too irresponsible. Many wives are too irresponsible. In fact, I used to tell people that, thank God that my wife is responsible. People will have been saying that, thank God he married a pastor, and so on and so forth. She's enjoyed in our house because she's responsible. If she were not responsible, she would have been living in hell. I cannot tolerate irresponsible character, irresponsible people, irresponsible children, irresponsible wives or husband, or irresponsible worker. I want people to be responsible. Like I said, my principle is, of all abilities, the greatest is responsibility.
With perseverance, diligence, and network, you and I can attain any height in life crowned with the mercy of God. On that note, we are ending this week's edition of the program, The Great Mind. Next Sunday is another date. God willing, till then, stay blessed.